hoping not to be wrinkled, like looking like.
I got total bedhead. I'm lucky to have hair that I can just walk out of bed and it doesn't look that much difference.
That's why I get the laptop pointing down instead of up, because it's great to get the. I'd come here and then you see the Costanza. The Mike Tirico. I got it.
That was great. Did you guys see when Shaq grew his hair out this year?
No.
God, it was so funny. Someone did a bet. He lost the bet, and the bet was you have to show us your hairline if you lose the bet. And he did, and it was like, it was just back like this, and he was doing it proud. It was so funny.
And probably he's been cutting it, so when you cut it like that, that contributes to the defollicilization.
Gotcha.
That is a word.
All right, so it looks like Larry's here. Today on our show, we've got an ER doctor out in the Bay Area joining us, the Notre Dame alum, who knows Trevor pretty well from back in the school days. So we've got Larry Burchett. Larry, tell us a little bit about yourself and what you do up there in the Bay Area.
Well, I'm originally from Kansas City. Graduated with my man Trevor, 2001, Sorin College. Go Otters! I think we may have. Did you play dorm football, Trevor?
Yes, it did.
I think we may have played a little football after your official football days.
Yeah.
I moved to California 14 years ago for residency, and I've been working as basically an ER doctor in California over 10 years. Worked in probably 25 or 30 different hospitals all over the state.
Cool.
We're right in the middle of this corona thing. There's not a ton going on in the hospitals that I work at just yet. It's certainly not like New York, New Jersey, where Trevor's at, where stuff's pretty crazy right now, but we're preparing for a surge, I have a 9-year-old daughter, and that's it. That's my life. I'm an ER doctor, and I got one kid. There you go.
All right, cool. Tell us a little bit about, the hospital now during coronavirus. You said you're still kind of prepping for what you're hoping is not too bad of a surge. What does prepping like that involve? What does prepping involve like that?
I think most of us in the ER who work in hospitals and ER, with the exception of these places that are just buried with work, like you see in New York, is our volumes are down. It's actually the slowest of my entire career, which is surprising to hear. I worked in a smaller hospital in wine country a week ago, and I only saw 4 patients on a day shift from 8 to 4. That's never happened. I mean, it's usually like a slow day might be 10 or 12, 15 is probably average. Saw 4 people. It's just, a couple people came in worried they had corona. They didn't have it. We're just not seeing it. All the tests are negative, and these places just haven't got there. So, but that doesn't mean that we're not still a little freaked out and going through all the stuff and wearing the masks and the gowns and, reading all these emails and meetings and all this stuff where it's just, preparation. But in these places, it's just not here.
Larry, that's really interesting that you're seeing a lot less visits. Is that I'm thinking less car accidents. Like, what things are down that you normally see a lot of patients for?
Well, I think most people are afraid to come in. I think they're listening. They're actually staying at home like they're supposed to. And then one place where people can potentially get exposed, unfortunately, is the hospital. And so smartly, people are staying home. They don't want to come in and potentially get exposed. I think what it's demonstrating is, and we know this, and that work in the ER is a lot of people don't need to be there. A lot of people use the ER functionally as kind of convenient medicine. Well, I don't want to wait to go to my doctor. I want it now. You go to the ER, which is one of the most expensive places to get your health care, just because we have, all of the critical care, life-saving stuff there for when we need it. And, the result has been, and this is, I think, across the board, is what I'm hearing from everybody, is just volumes are down. At least in California as of April, whatever this is, 10 or 11.
I can see how that I can see that working out in my own life or my personal life with my dad, who had a widowmaker heart attack over 10 years ago now, and he's outlived his first pacemaker, and he's on his second pacemaker, and outlived his prognosis. So it's been pretty great, you know, with how he's been doing. But he had an incident one of the other nights early on in this whole mess where the pacemaker went off, and he chose not to go to the doctor for that. I mean, he called his doctor, and you know, he's goes to appointments all the time with his condition and stuff. But I think it kind of relates to what you're saying. He was terrified to go there, so he decided to deal with it over the phone, and the doctor agreed with that. So I guess.
Yeah, I mean, one good thing that's come out of this is that the government and payers are now paying for telemedicine like this, where you can do it over the phone or over Zoom or whatever. That's a good thing. Hopefully, you know, we're not going to lose a lot of that going forward. I think it's more convenient for people. It might be a faster, more efficient way to deliver some medicine. There's still, you know, a good time to be seen in person, kind of lay the hands on. But how old is your dad? He's doing okay?
Yeah, he's doing all right. He's since has also had prostate cancer, and
Yeah.
they did, I for lack of the proper medical term, they did what we call the wait and watch. His PSA was low enough that they could really watch it, but then he had a spike in the PSA in the last couple of years. I'd say a year and a half ago or so, and they had to go and remove his prostate finally.
Yeah.
And so, you know, it was a whole process to even see if he was going to be okay to go under for that situation. And I think that it's left his recovery's been a little tougher than I think what some people might go through with that situation. So it's not been without its issues here or there, but the guy's a fighter, and he's hanging in there, and he's had a few bouts where it seemed to be getting worse, but he's doing pretty good right now. So
how old is he?
Sorry, I didn't say it. He is just turned 66. I want to say he is a leap day baby. So he actually had a real birthday. He's like 17 or something, I want to say, in leap day.
Yeah, you know, I mean, your story highlights exactly this time. I mean, here's a guy who is late 60s, so there's a little bit of risk that if he got coronavirus, he would get into trouble.
Yep.
But then he's got this history of heart disease, which makes him even higher risk. So there's a small, you know, I want to say something like 20%, maybe 20 or 30% of the way people die from coronavirus is heart stuff. Heart damage, heart attack, heart failure. I don't know exactly what the mechanism is, but so all of a sudden he is somebody where you really do need to think, gosh, should I go in for this? Do I even want to, you know, have I don't know where he lives, but you know, if he's in a place where that stuff's really circulating, that might have been the right thing to do, to stay at home and avoid this thing. You know, the older you are and the more medical the more medical stuff you got, the higher risk to really get in trouble. It's less threatening for kind of young and healthier folks.
Right. Well, then also, you know, my mom, who's not without her own conditions, then having to drive him there, so then she would get exposed as well. It's incredible how thorough, you know, the new way of living covers you in so many different ways, and you got to really think through the actions that you take. Now, they're not in a hotspot area at all, but they're super careful. So, and my dad is super over the top careful these days, and it's hard to argue with him because he's gotten this far after having, you know, a prognosis after outliving his prognosis. It makes it even harder to argue with, you know.
Yeah, careful people are going to survive this thing more than old, not careful people. Right. I had a guy just yesterday who came in wanting the test, and one of the things we do for people who are not super sick but want the coronavirus test is we keep them in their car. So they come in, nurse puts on the mask and everything, goes and see them. The patient doesn't even get out of the car.
Wow.
You know, check their vitals, do what we're going to do the swab if that's the right thing to do. And then they just stay in their car the whole time, which prevents, you know, them from getting exposed because they're not coming into the ER. But then also, if there's somebody who really does have it, it prevents everybody else from getting exposed to them. I've never seen that before. I've never seen somebody in their car who, that's how I like looked in. He actually had an ear infection on. I'm looking in his ear through the window. You'd think I was handing fries or something with that.
Wow.
It's the world that we're in.
Actually, can you help give some insight into what some of these numbers mean that we see? Actually, like I'm curious about like sampling bias kind of stuff in these numbers. So when you see the number of people, when you see the number of people tested and the number of people positive and that kind of thing, so like to what extent are people who are getting tested like people that are already feeling sick, and so like that's the group that sample represents versus like how healthy people.
Yeah, I think to kind of the question I get a lot right along your lines of statistics is, what's the death rate of this thing? Is it, you hear anything from 0.1%, 1% to 5 or 6%? And the first numbers that came out of China, the death rate was the number of people that died, divided by the number of positive tests. And I want to say the initial death rate was like, I don't know, 2, 3, 4%, something like that, which is alarmingly high. That's really high. And in a population of, 330 million in the, United States, if everybody got it, that's millions of deaths. And that's why people freaked out in the beginning. And as we kind of, learned that, oh, wait a minute, 80% of people just have kind of a mild cold and recover and aren't going to get sick enough to come in to actually even get tested, then that initial number, let's just say it was 3% death rate, then it's like, oh, well, it's probably much, much less, much lower, because there's so many people who aren't getting tested. With influenza every year, you have people that officially get tested. They have a lot of people who appropriately just stay at home. And so that's built into the annual estimate. I don't know how they do it, models, and I don't know how they do it. Can I cuss on this thing, by the way, or is it
sure? Yeah, absolutely. This show's called ND Generates, and we're like
ND Generates. Oh, ND Generates. I would have been. You should just be talking to Trevor like we're in the dorm.
Exactly.
We're having a hard time getting to those fun stories, but we plan to get there, and the idea kind of being ND Generates for good. We had I wouldn't say we had a reputation at school, but we like to have fun, and there's 2 different crews I always felt like when I was at school at Notre Dame, and one of them was a very large majority, the other one was kind of a smaller percentage of them, and we fell into that smaller percentage of like off-campus
res life.
Yeah. But we always like to do good as well, and we all we're proud of the people that we've become, and we've always been thoughtful, fighting Irish from the start. So long story short, we're down for stories, we're down for the language is fine. This is the internet, you can say anything.
Yeah, exactly. Within well, Larry, one real quick.
We're gonna edit this too, so we can cut stuff out if we need.
It's the internet. You could say anything. Yeah.
Exactly.
Well, Larry, one quick question is, I know, and I've seen recently, they've spoken about in African American communities, the infection rate and death rate being a little bit higher than others, and definitely interested to hear your insight in that.
There's no a little bit higher. It's pretty ridiculous. Adam, did that answer your question? Trevor, let me finish his and then to you. Did that kind of answer your question? I think you're right that the statistics we have on this thing, in time, we're going to get better numbers as there is more testing available. And we actually test. So they're doing studies where they're taking a whole group of people, whether they have symptoms, they're sick, or they're not sick. And they're trying to get a better understanding of how prevalent is this disease? How many people actually have it in a community, including the sick people, but also the people that aren't sick, because there's a fair amount, maybe 15, 20%, who have no symptoms and who have the disease and may actually transmit it to people. So you know what did Nixon say? Lies, damn lies, and statistics. Like you can use these stats all kinds of ways, and people are in the media. I mean, that's a whole other political
Yeah, it absolutely
media
is.
thing. Speaking of statistics, Trevor, this gets to exactly what you're saying about disparities in health, which this thing will, if people, if this gets picked up in the media, or if people actually listen, it's just another reflection of, American healthcare, which, is not, there is no equality or fairness across, money, environment, race, ethnicity, immigrant status, all of these things, if you are upper middle class, well-to-do, et cetera, white, you're going to do better. So I'm going to send you this statistic. I don't know if you can include these things.
That'd be great. Yeah, we can.
So this thing shows COVID's devastating impact on African Americans, and it shows a handful of states that show that the states and state or city's population: Louisiana, Illinois, Michigan, North Carolina, and then Chicago. So 4 states and then Chicago, where African American in Louisiana make up 32% of the population, 70% of the deaths from COVID. That's ridiculous.
Whoa.
I mean, that just points at, whoa, what is going on? I mean, you're talking Louisiana, so the first thing that I think of is obesity, right? So folks there, people that die, again, typically tend to be older, but then have worse health to begin with. And so African American community in that state probably can be heavier, have more diabetes, high blood pressure, heart disease stuff.
The food down there is just so good. I mean, can you blame them?
Well, so that's the issue. Is it just like kind of a cultural food thing? And then there's a whole big topic of, environment, access to appropriate health care, education, all of these social determinants of health that really, I think, it just highlights this issue again, but very well. So let me give you the rest of these numbers. Illinois, 15% Black, 42% of the deaths from corona. Michigan, 14% Black, very similar, 41% of the deaths. North Carolina, 22% Black, 22% of the deaths. Chicago, 30% Black, 69% of the deaths from coronavirus.
Wow.
That's crazy, guys. Like if you that Chicago number of 69% of the deaths and Louisiana 70% of the deaths.
Alarming.
It raises a lot of questions.
Right.
Right?
And it ain't not like
And North Carolina being, basically an outlier, right? Like right in line with population. That's fascinating.
there's some statistics for you. I don't think
Not
it
that
has
the virus just likes melanin.
Yeah, the melanocytes, higher percentage of just because you got brown skin. I don't think that's what that means. So it's another reflection of, unfortunately, this is American healthcare, and it's another reason to look at that and say, what are we doing here? Why is this right? How can we make this better? And it's really that's a huge thing. It's a huge thing.
Yeah, absolutely. Good question, Trevor. That really shines a light on some major inequalities going on. And
what do you guys think of that? I mean, what do you make of it, Trevor?
I mean, my thing again is, and this touches to what we're doing in the community as well. Education, food, service, a lot of the things that people in these communities don't see as often unless it's for a photo op. And it's unfortunate. And I think what we're looking to do, especially with bringing law enforcement in into a lot of the things and the events that we run, it's giving people hope outside of what you think is there. And again, diet and gentleman's diet, nice little plug on that. I mean, it touches to that. You eat right, you live right, you exercise, you take care of your body, and you're going to be in a better situation to handle certain things like this. Not to say it's going to prevent it, but you want to put yourself in the best position possible to succeed in life. And it's very important. As a society, we need to value that. And, I appreciate you shedding a little light on that.
Yeah, it's a thing. And it's, as a doctor doing this long enough, I think our experience attests to numbers like this. I worked in Compton in South Central LA for 2 years, and it's just right. It's just right in your face. Just obvious. This isn't, we can't forget who goes to college and has a complete, cafeteria platter that we had every day to eat from. Like, I think about my patient. It's like, for many Notre Dame people, that's just a metaphor for life. Think about my patients, at Compton, who come in with heart failure, kidney failure from crack cocaine, and I'm pleading with them to stop using. They go back out, and it's on the street everywhere. Like, the environment is just, I don't know what the tone of your show is. We're getting deep.
Yeah,
that's all right.
That's right. We're willing to go wherever, and it's
Yeah,
important
exactly.
stuff to highlight. And and as important as diet and exercise and all these things are, I think it's worth mentioning that there's clearly something else at play when you're looking at these kind of disparities in statistics. And what that is maybe for a different show or to get into, but.
Well, I'll tell you. I mean, there's a lot of things, but there's
systematic racism, right?
Yeah, exactly.
Component of that thing.
A perfect segue. We do a follow up to this episode, and then we not only talk about the situation, but we talk about ways that we can cure this situation. So,
yeah, absolutely. Well, on that, let's change the tone a little bit. We're running into our last 10 minutes. And we want to make sure we've kept the cap on this because we don't want to occupy people's time too much. And we also, as important as it is to get the message out there, we all want to also have some fun and keep it lighthearted. So let me ask you some of the less verified reasons why people are coming to the doctor. Do you have any thoughts on some of these conspiracy theories, or do you have any stories on any specific patients, obviously without naming anybody, that have brought up funny points? Obviously I can't stand this whole 5G conspiracy. It drives me crazy. I'm also very anti-vaxxers. So both of those seem to be things that are popping up, between crazy conspiracy theories as well as like people thinking that Bill Gates is giving us a vaccine to try to lower the numbers of population or something.
It's just such a weird time with the internet and having all this access to information and social media, but the stuff that goes viral it's nonsense, conspiracy theories, stuff, whatever. It is so much more likely to go viral, get clicked and read, and it's crazy how people believe it. One of them, we were talking about race. One of them is Black people can't get this.
Yeah,
Trevor, did you hear that one?
Mm-hmm.
I saw that. I was like, whoa.
You guys,
yeah,
wrong and very dangerous, and like a fascinating from a cultural standpoint. Like, where did that come from? Black people can't get this. This is a white person's coronavirus. Wrong. And I just thought that was really funny.
Right.
I think one thing that kind of along the anti-vaxxer thing that I can't stop thinking about. I can't believe that this physician said this, but and she was an MD, but she put on social media, this big long rant post about not believing in the germ theory of disease. Oh, the media and this virus. Oh, it's just so terrible. That's not what makes you sick. And she goes into this whole paragraph about why she doesn't believe in the germ theory of disease. And I was just like, how are these people?
So what did she blame?
How are these people? How is she? Like, you want to have, you can look. I like a diversity of thought with healthcare, and my way is not the only way. There's plenty of, but the germ theory of disease is like one of the basic science, like the science was so, those basic experiments that demonstrated how disease was transmissible from one person to the next, and then basically washing your hands. Some of these studies they used to do because doctors used to deliver birth and they didn't even use gloves. And so they'd catch a baby in one room and then they'd go to another room. And they were able to trace how some people would develop disease. And then back in the day, I mean, to us, it's like, whoa, wait a minute. They didn't even wear gloves. And they
Right.
had like bloody hands from one delivery to the next. Yeah, that's how they did it. It was one of the ways that we discovered that disease, they could figure it out. And it was like, oh no, that was how it went through. So it was just some of this new age nonsense was the answer. No, that's not how people get sick. People get sick from, their lifestyle and their energy and their and I was just like, I believe that stuff all matters, but to deny the germ theory of disease, and this was, physician that had an MD who had a handful of followers, thousands of followers, and I was like,
blasphemy.
It's disheartening to see how easily influenced some people are online without really any factual backing or any ability to kind of to trace to follow the tracks to see where this info is coming from. It's so disappointing.
Well, I mean, I'm all about confirmation bias. So, like, I really think the science behind that idea that you should be drinking a lot of hard liquor, that really seems to be well for me so far. I'm keeping my, brown liquors and white liquors in balance, and keeping the germs and the negative energy away from me and all that stuff. So, it's science.
Touche.
Yeah.
Touche.
I might suggest that you use the longer plastic bongs as opposed to shorter shot glasses. I just feel like those little shot glasses are probably a greater risk.
I got to write that down.
Yes.
You might do some personal experiments with that.
Yeah.
Just a
nice.
suggestion.
Well, speaking of beer bongs, do you have any dirt on Trevor from back in the day that you can share with us?
If I would have known that this was the kind of thing we were doing, I would have called some people and dug up some stuff.
That's why we got you early.
All right.
You don't need to go very far to get a nice chunk of dirt on Trevor.
I was gonna say I'm impressed, Trevor. I thought there were more readily available things.
Well, Father Steve was on Larry's show about a week ago, so I don't think he consulted with Father Steve before he came.
Trevor, you're lucky. You're going to get away. It's off on this one, and I wish I could just nail you to the wall with something, but I don't have a terrible, incriminating story that's coming to the top of my mind, which is mind-boggling because I shouldn't have to go very far.
Well, maybe you want
we bribed Larry with PlayStation. That's what we did.
Nice.
With PlayStation and snacks.
Who was breaking Pridles more?
A loyal friend. A loyal friend.
Who was breaking Pridles more, you or Trevor?
Oh, shit. That's an easy one. I was a good kid. I was a good boy. Trevor, I'm sure, had a little more fun than I did.
A little more fun than all of us, probably.
Trevor's
well, and like you said, was one reason why we're bringing you on here. I mean, there's many reasons why we're bringing you on here as one of the first guests, but we hope to have you as a recurring guest, and we hope that you enjoyed your time with us. And we'd the time flew by in this conversation. I didn't get to nearly all the questions I wanted to ask, so we'd love to, we know you're really busy, especially busting these 24-hour shifts and stuff, but we'd love to maybe have you as a recurring guest and have you come on more often if this thing gains any steam.
Happy to be here. Hope it wasn't too wordy, and I promise you this: when I come back, I'll bring a story of Trevor.
Nice. Is there?
Trevor, you be careful if you really want
go.
to come back or not.
Well, we will certainly have you back. Luckily, with the 3 people, we've got a majority vote we can get on here, so you can make that happen.
I think you know what's coming if I come back.
The dirt.
Now, one thing we didn't get, we like to highlight, different charities and different opportunities to give. Is there anything that you'd like us to direct the traffic to, or any charities or anything that you would recommend some people to give to
Yeah, Trevor asked me about that. I just say the American Red Cross. I think they're pretty reliable, and especially blood. If people, you can donate money, but if an easy thing to do is go donate blood. Blood banks still are needed. Internationally, that's a domestic one. Internationally, Doctors Without Borders is always doing the right thing and going where nobody else wants to go. Those are two places I would point.
Great.
Very cool.
Great. We'll make sure we highlight those and add some links when the show comes out. We're running into our last our run out of time here. Sorry. I want to say thanks to Larry for joining us on the show. You're out there on the front line taking care of us as a society, and you're some of the most important people out there helping during this crisis. And we really appreciate you taking time out of that important schedule to come here and join us. Yeah. We hope to do this much more often and have you back on the show when we can get you.
Yeah, my pleasure. Thanks for
Larry. Real quick, one last one. We have an over/under for every guest. Over/under. How many bottles of Purell do you have in your arsenal?
Here. Oh, I'm not a germaphobe. 0.
Okay.
Yeah, nice. Just soap and water is good enough for me.
Soap and water. That's all you need.
Antibacterial.
0 Purell. I could, I could probably steal them from the hospital, but I don't.
Yeah.
To be honest, I think I've probably already been exposed and have this thing and am immune. So working in the ER, I've probably gotten almost every virus, every respiratory communicable.
Correction.
Fellas. That kind of stuff. I think I'm fairly bulletproof, but no Purell here.
Nice.
Well, we'll start off the next show when we bring you back to tell you more about how we got here, and hopefully by then we'll learn a little bit more about why we're here. No, just kidding. But the way this app works is going to cut us off, and we've promised to not to take too much people's time. So we want to thank you so much.